Since iron overload only causes about 10% of high ferritin cases, you're going to learn about another cause of high ferritin, which is illness, specifically cancer, and how to figure that out. And if you find this information useful, please like and subscribe so more people can see this video. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. I've been blessed to have seen over 100,000 patient visits over the last 39 years, many of whom have gotten thyroid issues, and abnormal ferritin is a common thing I see. As this patient, a 48-year-old male, came in with high ferritin, high blood pressure, fatigue, brain fog, stomach pain. His initial labs confirmed his high ferritin in the high 800s, high or above optimal glucose, insulin, A1C, CRP, uric acid, cholesterol, triglycerides, PSA, and low or below optimal HDL and testosterone. He clearly had metabolic syndrome, also known as insulin resistance or prediabetes. He was obese, 270 pounds, high blood pressure, belly fat, and this is the most common cause of high ferritin. So I put him on an anti-inflammatory diet I call the free diet and the proper supplements. And in 6 weeks, he had more energy, less pain, dropped 30 pounds of excess weight, normal blood pressure, and the following labs improved to normal or more optimal levels: glucose, insulin, uric acid, cholesterol, HDL, triglycerides, testosterone. And what only improved slightly, though, is his ferritin. It only went down about 4%, so it was still in the 800s. And that was unusual, as I typically like to see at least a 30 to 50% improvement in ferritin levels to go along with these other improvements. So it could have been that he just got over being sick, and that can raise ferritin. So we rechecked at 3 months, and he continued to see improvements in his lab markers, dropped another 15 pounds of excess weight, and yet his ferritin only dropped like another 10 points, still in the 800s. So something was going on, and his testing indicated out of those 7 areas of high ferritin, it wasn't liver disease, alcohol use, insulin resistance, infections, inflammation, iron overloads. All that was left was illness, specifically cancer, as his PSA remained elevated. So I referred him out to a urologist who did the proper testing, and an MRI showed that he did have prostate cancer, and prostate and other types of cancer are known to increase ferritin levels. So if you have ruled out or are addressing all of those potential causes of high ferritin and you aren't seeing improvement, that's when you need to look further with more advanced testing to discover what's going on. And oftentimes your doctor will say, oh, well, until your ferritin's over 1,000, I wouldn't worry about it. Well, that's simply not the case. If your ferritin is elevated, you want to make sure you get to the root cause. And even though this patient was diagnosed with prostate cancer, we were still able to, over time, like 18 months later, his ferritin was in the normal range. It had dropped over 500 points. So you can still make improvements. And the idea is to get your body in the most optimal, healthy state so that you do have the best chances of healing and recovering from whatever condition you have. And cancer is considered by many to be a metabolic disease. So having metabolic syndrome like this patient had increases the risk for cancer. So getting your body in the healthiest state is the best path forward. So if you have high ferritin, don't assume it's from iron overload and run out and start donating blood. Get the proper testing first, because if you find out the root causes and are provided the right solutions, I believe almost anyone can get better. I'll put a video that goes into the proper testing in more detail and the 7 causes of high ferritin here, the free diet phase 1 food chart below that we'd be happy to send you. Feel free to like and subscribe so more people can see this video, and I'll see you next time.